Hi Dennis, Rich here. Very disappointed to hear of the early retirement, and we all are particularly saddened to hear of the reasons behind the early retirement. But at the same time, I think it's a fantastic opportunity for us to be able to come together on this forum that Jim has proposed for us to honor what has been an absolutely remarkable career, and to give you a very heartfelt and sincere thank you for your influence on our training and career paths. So for that, I couldn't resist but treat myself to a Argentinian Malbec Reserve in your honor. And tonight we celebrate your career. You have been, from the moment we met at the cafeteria in Halifax, to the excitement of getting the fellowship and to the privilege of having worked alongside you during my fellowship. You've been so supportive of my career from the start, and really you really have been a confidant of mine, and I am immensely grateful for that. I think by the time our paths had crossed, there was no general surgery problem that was beyond your expertise. You really are a masterful surgeon. Certain skill sets that I attribute to you that I've subsequently adopted are the medial to lateral mobilization and a right hemicolectomy with an early identification of the duodenum and working within that plane is really novel and very effective. Of course, your ergonomic grasp of the laparoscopic Metzenbaum during a long, sharp adhesiolysis, as well as the Klassen grasp of the appendix to enable a single-handed dissection, as well as easy instrument transfer and specimen retrieval in a lap appy. Most surgeons I'd met before you were either tappers or teppers. You were actually the only surgeon I'd seen who had both a tap and a tep in the same list, and you taught me both, and taught me, importantly, the right operation for the right patient. I didn't think there was anyone out there who despised the smoke extractor as much as I did until I met you. Of course, your OR banter is next to none, and your general surgical knowledge is in a league of its own. Given your capabilities, you really do create such a relaxed atmosphere in the OR, and I always thoroughly enjoyed, and we're very excited to come to your list, and it really was a privilege. Dennis, you are a gentleman and a scholar both on and off the field. Of course, it was an immense privilege to work with you in the operating room, but even more so to enjoy the times outside of work. Certain highlights must have been the dinner we shared together that you spoilt us to in Baltimore, which ended up in the Skyrise drinks. And more recently, it was a real privilege to be able to pop in and see you in San Francisco and enjoy some time together then. I really do look forward to catching up and celebrating what has been an absolutely remarkable career, and thanking you in person. I really do believe I'm a better surgeon and, importantly, a better father because of your influence, and for that I'm eternally grateful. So Dennis, tonight, here's to you. Thank you.